guys, I'm Steve. I'm a physiotherapist from Australia. I've worked in the best clinics in the world and I've trained with the top researchers in physiotherapy and I'm up to date with all the evidence. So I want physio to be available to anyone, no matter how much they earn, who they are, what they do. It's really beautiful knowledge and I want to spread it with anyone who can't access it. So anyone in countries where you don't have available access or people have problems in your community, whether this is for you or this is for a person you care about or you're a healthcare practitioner trying to help your clients, I want you to hit subscribe and I'm going to be posting out everything I know, everything I've learned from the next 10 years, all for you. So today we're talking about the shoulder, and the shoulder is complex but also kind of simple to understand if you think about it in a couple of ways. So one thing to understand is the shoulder is a really common cause of problem, which means people get pain, problems, really common to get like bursitis, rotator cuff tears, tendon problems, but it's not always the reason it's there, because oftentimes if you're weak through the abdominals or the torso, or if you've had an accident and you've lost mobility in your spine, or if you've had a neck injury, or even if you have a problem with your leg, the shoulder ends up being the victim. So because it's really mobile, it tends to have more problems than other joints. So just keep that in mind when you're training it. And if you're still having problems or this isn't really working, it's probably because there's something else going on from an old injury you're compensating around. So to understand the shoulder, you have muscles on the outside, the external rotators. External rotators essentially do this. And then you have the internal rotators essentially doing this. So there's muscles that pull up and out and down and forward. 9 out of 10 people have an imbalance where they're too strong in the muscles pulling internally or down, and weakness in the muscles pulling externally or up. I don't know why this is. It could be because from when we were walking on all fours, we came upright, and it's actually easier to lift the shoulder using internal rotators. Or a lot of people are having issues with their abdominals and this kind of thing, and then that's a common pattern. Anyway, we're going to try and down-train internal rotators and up-train external rotators. So the common pattern is people push or overwork their lat and internal rotators coming up like this. What it does is it pushes the shoulder down and forward, and it narrows where the rotator cuff comes out through the scapula. So if you look at the anatomy here, you can see there's muscles on the inside of the shoulder and muscles on the outside. So if you have crappy scapular mechanics and you're dumping down, you're going to start irritating all the structures through here, which cause a lot of the things you might be feeling. And that can lead to people going and getting rotator cuff operations or surgery or cortisone, but it just comes back because they haven't really trained the real reason it's there. So what we're essentially trying to strengthen is the muscles through the back of the shoulder in this program. That means you're trying to strengthen the tricep, the posterior cuff, and the trap. So it's this sling through the shoulder to help support the shoulder through elevation and offload while you're getting pain. This generally takes about 8 weeks, maybe even more. And it's a progressive exercise program, which means if you try and do the really hard exercises really early, you're not going to have the strength through these muscles and your problem's probably going to stay there. Okay guys, so this is an isolated tricep exercise. The principle isn't just to train your tricep, because you're kind of training your brain to down regulate or not use the internal rotators. So it's a little bit like if I move this finger, all the fingers go together because my brain's wired them together. So you're essentially teaching yourself not to move the other fingers as you just do one. So you're training your brain more than anything. So you just start with a weight, and you can just start by, the common issues are people push with their armpits like that, and that's going to use those internal rotator muscles. So you're essentially trying to press as you try and relax the armpits back off your body. So you press, relax the armpits back off your body. So you shouldn't really use the armpits. A good way to tell if you're doing it right or wrong is using a head lift. So you can lift your head, and if you're using your armpits, your head will get really heavy, hard to lift because they will pull into the neck. If you're doing it well, the head will be nice and easy to lift. So then you're going to try and keep the armpits out of it, especially the affected side, as you just come down and try to relax the armpits, pushing off with the elbow. You should get a little wobble in the tricep or a little shake. So I'm getting a little one in the right. Common problems are the shoulder will twist. So this is what I see all the time. So you're just going to try and do that. Eventually you can take it higher, and then you can go to one arm, the affected side. So you could also take these principles into doing a press like this without the armpit coming in, or a fly, trying to relax the armpit around your body. But if you're looking for one thing to do, train your tricep. That's going to be number one this week. Tricep, tricep, tricep. And so another strength hole you want to get started really early is the external rotators. It's called the infraspinatus, but don't worry about that. All you're essentially trying to do is elevate without using the armpits. So it's really helpful to use a little red band. You can get these from chemists or Rebel Sport or something. Good investment, they don't cost much, and you can use them for just about everything. So what you want to do, get your little band, do a little squeeze. This exercise is from Joe Gibson, really great physio and a specialist in shoulders. So we're just going to really gently pull away with the band and start to punch, and you're thinking about just getting that little bit of external rotation into elevation. Common patterns people will do with this is they'll go too hard and they'll use their armpit, or too hard and they'll just kind of pull around their scapula. So you want to really just target the shoulder. A good cue is like it's a little golf ball spinning around in a T as you come up. So you can think about this little golf ball motion. With these exercises, do about 3 reps of 10 to 15. You're just trying to fill strength holes. This can take a week or two, and until those strength holes are filled, you don't want to do that much more. So just get started with some easy stuff like the press, tricep, and band punch. Next week, or even 2 weeks, depending on how you feel, we're going to move into wall exercises, which are pretty easy too. So I'll catch you then.